Protect yourself and our community from COVID-19. Wash your hands frequently with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer with at least 70% alcohol. Use a tissue when blowing your nose, sneezing, or coughing. Immediately discard the tissue properly and wash or sanitize your hands. Avoid close contact with people who are sick. Let's do our part to ensure that each and every Grenadian remains healthy. To stay up to date, visit the Government of Grenada's webpage or the Ministry of Health's Facebook page. For more information, contact the Ministry of Health's hotline by calling 53-VIRUS. This has been a public service announcement brought to you by the Ministry of Health.
I am Press Secretary Philomena Robertson. We do apologize for the late start to this press briefing, but we've been experiencing a few technical difficulties. We hope we have them resolved now, so we will get started. Thank you so much for your patience, and thank you for tuning in. To members of the media who have joined us, thank you. To members of the listening and viewing public, welcome, and thank you so much for joining us for this update. With me this afternoon for this briefing, I have the Health Minister, Honorable Nicholas Steele, Commissioner of Police, Mr. Edwin Martin, and our National COVID-19 Response Coordinator, Dr. George Mitchell. To get things started this afternoon, we will have opening statements by all of those represented at the head table, following which we will go into the question and answer section. We will start with the Honorable Minister, Nicholas Steele.
Well, good afternoon to you all. Good afternoon to all of our viewers and listeners out there. It is always a pleasure and an honor to come before you and address the various pertinent issues. I want to say from the get-go to congratulate and thank the teams that have been working, teams plural, throughout the island, not just the Ministry of Health teams, but RGPF and everyone else that has helped, and our citizens at large in general, that has helped to maintain the orderly reopening as best as possible to date of our economy and activities, and to date has allowed us to remain relatively safe with respect to COVID-19. We have also started the repatriation of Grenadians who were stranded on cruise ships. We actually released the first two batches that came in, which were those that came from Princess Cruise Line and those that came from Carnival. Both have been cleared completely. All of the individuals have cleared their quarantine and their rapid and PCR testing, and have been allowed to go home, and I'm asking the Grenadian public to embrace them as our fellow countrymen, brothers and sisters and sons and daughters who are now free to roam like the rest of us under the new norm. We do have others that are currently still in quarantine. A group came in yesterday as well. And sometime during the proceedings of this press conference, I expect to get the results of those tested, and will immediately share that information with you. As of now, I don't have it, but I expect it somewhere about 4:20, and we'll share it with the Grenadian public then. My fingers are crossed. This is also a test of our border controls, our health screening at the ports, and I want to say to the public that we do expect, as we repatriate more and more Grenadians and have other individuals maybe visit our shores, we do expect to find positive cases. The difference is that we expect to pick them up at the port, or pick them up immediately after they have come into Grenada, and be able to isolate quickly, and that is the only way that we can move forward. That is the only way that we can exist with COVID-19 in the world. And that is the only way that other nations that have been on lockdown and are going through the same journey like us of opening up are contemplating as the way forward. Stronger contact tracing, stronger quarantine methods, stronger port screening methods, and picking up those results as quickly and as early as possible. That also necessitates, as we move forward, the need for us to still maintain our level of due diligence, our various precautions, and with that combination of us practicing the physical distancing, wearing of masks, and sanitizing methods, as well as the improved port screening and quarantine methods and contact tracing methods. Once everyone does their part, then we can maintain a safe as possible society. I want to specifically say, moving forward, remember, it is a case of balancing risks. There is no perfect situation. Trying to stay on lockdown, we all remember vividly still what it was like to be on lockdown, and that this is not tolerable indefinitely, and that we do need to get back to a new norm. And in getting back to a new norm, it is balancing risks. It is not being throwing caution to the wind, but it is balancing risks and mitigating risks. Thank you.
Thank you very much, Minister Steele. Commissioner?
Yes, thank you very much. Thank you very much, Ms. Robertson. And let me also take the opportunity to say a pleasant good afternoon to everyone listening and viewing this press conference. And I want to say out the gate that the RGPF will hold a press conference tomorrow to bring greater clarity and emphasis to the new regulations, as well as to expand on some current and ongoing law enforcement and operational efforts across our tri-island state. However, for this press conference, I want to focus on a few of the new easements with the current regulations to aid some understanding for the public, which is due to implement effective tomorrow. The new regulations, first and foremost, will take effect tomorrow morning at 7 a.m. and will be enforced through to Wednesday, June 3rd, will be enforced through that period of time, May 26th to the 3rd of June. And in essence, the regulations remain essentially unchanged for the most part, with the exception of a few additional easements as has been approved by Cabinet. And I want to just highlight some of those easements that has been raised. One is the approval for the operation of retail stores, and that will operate between the hours of 8 a.m. and 5 p.m. Also, the beautification industry, which has to do with salons, barber shops, cosmetologists, entities, etc., that will start to operate as well between the hours of 8 and 5. We also have approved limited inter-island transportation that will be taking place, and we also have approvals in this regard as it relates to Offspring and Dolly C that will be carrying out some measure of inter-island transportation activity. All other persons, the fact that this is limited, all other persons having desire to travel to the sister isle will apply. According to the regulations, will require approval from the Ports Authority and the Ministry of Health in order to give effect to this. We are also looking to give effect to public transportation in the very near future. And currently we have ongoing discussions with all stakeholders, including bus associations, with the hope of ensuring that public transportation will become a reality in short order as an additional easement in improving the quality of life of Grenadians all. I want to, in closing, however, emphasize just a few issues of the new regulations that continues to be of critical importance to us. And first of all is the fact that we continue to exist in a state of emergency. And that is, we have a period of time where we are allowed to carry out and move about and carry out activities that are approved through the easement. We need to ensure that once we carry out those activities, we continue to stay in our place of confinement as is required by the regulation. As a continuation as well, the full curfew remains in effect from 7 p.m. to 5 a.m. on mornings. And in that case, there will be heightened law enforcement activity to ensure that persons do comply. I want to appeal here to the general public to please, as we continue to have more and more easements, it is becoming more and more demanding on the RGPF in order to enforce and maintain the intentions of the state of emergency regulation. It would be a significantly easy task for the RGPF if we achieve some attitudinal changes from members of the public and assist us in this effort, not only by controlling their own behaviors, but also influencing the behaviors of persons that they do have influence over. So cumulatively, we will have a resounding result in our continued efforts to stem this potential spread of COVID-19. Finally, I also want to address the very salient issue of the wearing of masks. And masks, we continue to advise the wearing of masks at all times. However, our regulation requires that we wear our mask whenever we're going to enter any lines to access service or when we are entering any buildings. This precautionary measure, advice, and legislation is in an effort to protect ourselves and also to protect others. So again, it is one of the most significant attitudinal changes that we have to achieve as a people. And I want to urge us to continue to cooperate with the intentions by the science, by the medical advice, and the intentions of government as we seek to continue to make Grenada a model in this fight against COVID-19. I thank you at this point in time and look forward to your questions later.
Thank you very much, Commissioner, for your opening comments. Dr. Mitchell, a few opening words from you.
Yes, let me say good afternoon to all your listeners, both locally, regionally, and internationally. And I would like to join the Minister of Health and the Commissioner of Police in saying good afternoon, and we hope that you are doing well out there. First and foremost, let me emphasize that we continue to open gradually. We continue to open as safely as possible, and we continue to open based on the science. I also want to re-emphasize that in this period, the issue of vigilance, as was mentioned just now by the Commissioner, is of utmost importance. We can't, as we open, rest on our laurels and become less vigilant in terms of what we need to do. Although in the recent past we have not had many cases, but we must remain vigilant as we go forward. We know of the disease, we know how it comports itself, we know that we can have asymptomatic persons out there, and though we are doing well at this time, we cannot lose sight of the main goal. And I want to re-emphasize that we said here before that one of the key objectives is to ensure that we don't lose lives. We want to ensure that the health of the nation is of paramount importance and that we continue to do all and take all our decisions with that in mind. So I would stop here. I would not be as lengthy as my other colleagues in terms of our opening remarks, and I would open for questioning.
Thank you very much, Dr. Mitchell. I'm just looking at the time and I see that it's 4:20. Minister, do you have an update for us at this time?
14 tests were done today. All 40-odd individuals, 46 individuals who came in yesterday were rapid tested. Of those, there were a certain amount that raised a flag on the rapid test, and those individuals were tested, of which 14 tests were done today. Of those 14, 13 are negative, 1 is positive. One of the individuals from the cruise ship is COVID-19 positive at present. This I'm treating differently because this one we expected to in the process of repatriating. This was why we had these constant negotiations and discussions that resulted in delays of bringing our sons and daughters home. But it shows that our system of screening and our reason for being cautious is valid. So I want to thank those who were involved in that screening process yesterday and making sure that these individuals were quarantined. I want to use this as an opportunity to reinforce to those who did spend time in quarantine and did have some issues to say that this is why. This is why we asked them to go through that additional hardship, so to speak, or inconvenience before they came into Grenada fully. And that in our opinion, these individuals have not fully been brought back to Grenada. They are on our shores but being held in quarantine, and in that quarantine process we have picked up one individual that is positive. All individuals will remain in quarantine, and all individuals will be tested by PCR before they leave quarantine, regardless of whether they show any symptoms or not. That is to safeguard them and all of us in society in Grenada.
Thank you very much for that update, Minister. So there we have it. There has been one additional COVID-19 positive case that was confirmed today. So that is the latest update from the ministry. And you would have just heard the minister explaining that this was particularly important for us in terms of repatriating Grenadians, the quarantine period, the significance of it, ensuring that persons are not immediately allowed to go into the population and therefore increase the potential for the spread of the disease. So the floor is now open for questions. Fellow journalists, is anyone ready? Mikey, I see your hand up. You can have a first go at it.
All right, hello to everyone. I just want to start with the last thing that we addressed first. In the persons who just came into Grenada, the one person who tested positive, were they screened prior to leaving that cruise ship? Did we have any prior knowledge that that person would have or could have been positive?
Well, Mikey, most of the cruise ships, if not all of the cruise ships, have given us assurance that individuals have been on the vessels and under quarantine conditions, and that we should be allowing them, like other countries have, and allowing them in as though they had done their quarantine. We felt differently, and some countries also support us with that feel differently, that unless it is in conditions that we have complete and full control over, and i.e. more specifically observation of, then we cannot trust the health of the entire nation to that. It's not necessarily assuming that the cruise ships are not are dishonest or so. It's the same if it was another nation or so as well. That we have a vested interest to the people and a responsibility to the people of Grenada to make sure that every step is taken at the port of entry to ensure those who are inside are protected, and that necessitates the screening and, to date, the quarantining of individuals who return. As time goes on, those types of methods may change, as we're seeing with other countries as well. They're looking at different modalities, and also it would depend on where individuals are coming from. So for the time being, our methods have proved to be valid. We are vindicated in our discussions that we have had with the cruise ships that it was necessary for us to have this quarantine, and to assure ourselves that individuals were actually cleared. And we will continue along those lines with respect to nationals returning from cruise ships.
Okay. If I may ask a second question, is there already an established protocol that persons coming into the country would need to follow once we decide to open back up our ports?
There is an established protocol right now that is being exercised and is working as point in case that I just discussed. There are discussions that are being held on an OECS level. There are discussions that are being held on a CARICOM level. What I can say is that Grenada is actively part of those discussions, and to date, we are ensuring that while the agreement is to have a minimum standard throughout CARICOM and OECS, there is the ability of any nation to add additional criteria. And for all intents and purposes, and for the discussions to date, Grenada is going to be going ahead with additional levels of safety, or additional safety measures when we do open our borders. We are not going to open our borders until it is practical and safe to do so. And part of making sure that it is practical and safe is to make sure that we have spent the right amount of time and resources to make sure that the systems are in place, the individuals are comfortable with those systems, including those in our hospitality service and those at our airports and so, who have been receiving people to date, and our ports. They have been receiving people to date, but it's very different to receiving a large aircraft with individuals. And our hospitality industry as well. We do hear the conversations being had with other countries, and we do recognize that we will have to contemplate it, but we want to make sure that we have crossed every T and dotted every I before that happens.
Thank you very much, Minister. Nancy Maguire from the Grenadian Voice, you have questions?
Yes, good afternoon. I have a question for the Commissioner, and I have one for Dr. Mitchell. I'm wondering, for the Commissioner, you mentioned the need for attitudinal changes that would help the police force. And with all these increased responsibilities that you have as we open more for monitoring people wearing masks in lines, for this new protocol for the yachting industry, how are you distributing your human power to do all these things, Commissioner? And for Dr. Mitchell, I'm wondering about our contact tracers. How many we have? How are they trained? And if somebody's out there unemployed thinking this is a good way they could help, how would they go about becoming a contact tracer? Thank you.
Thank you very much for the question, Nancy. And thank you for recognizing the fact that if we were to do this all by ourselves, we actually are expected to be magicians. Suffice it to say, we do have a very good population. And we have been able, through this exercise, to be able to leave certain areas up to actually the community support. We have been able to effectively police some area because the vigilance of the community has made it easy so to do. In that the community has been keeping an eye out, understanding what is required, reporting those instances as soon as they're observed, and facilitating our response to that situation. Specifically, we prioritize as well how we deploy our resources to achieve maximum effect. Case in point is now the yachts that are in place with respect to quarantining for the period of time, and how do we ensure that achieves maximum effect, given the intention of the state of emergency and government intention in this regard. And what we have been able to do is to deploy one of our platforms in that area and to remain there on a 24-hour basis and rotate staff onto it to ensure that 24-hour vigilance is achieved on a top priority situation. And that is to achieve two things. One, to send a very strong message to the persons who are within our space that Grenada is very serious, and also to ensure that we do everything given our capability to ensure that our population remains safe. Another factor that I must mention here is the recognition of government of the additional support that is required by the police force to effect its functions. And we already have, in consideration of the task that we have in the concept outlined for implementing the potential of public transport, government has already approved us taking on board an additional 15 wardens. So you have a situation where the community the police force, by its strategic deployment of personnel and the support from government, all given the extent of the various capabilities, cumulatively is working together to achieve the desired intent. Thank you very much.
Nancy, thank you so much for your question. You've hit on a very important key consideration in opening up, and that is, of course, the issue of contact tracing. Contact tracing for us, along with the issue of quarantine, as Minister mentioned, the issue of testing, and the issue of knowing where we are really, really, really key in going forward. So yes, we have begun to strategically build on our teams on a parish basis. So this is something that we are constantly building on. This is something that we're constantly perfecting. And yes, they are going to be trained. Some of the key elements in that training are going to be confidentiality, discretion, allowing for and to ensure that the issue surrounding COVID as we have it. And, as I said to someone this morning, sometimes it baffles me in a way of the reason why we have so much stigma attached to COVID, because COVID can, anyone can get COVID. We saw what happened with the Prime Minister of the UK, Mr. Boris Johnson. We saw it happening to other celebrities and everybody, some lots of people. So the issue of stigma is something that we want to ensure that does not happen. But at the same time, we want to make sure that persons doing the contact tracing recognize that. And so the issues surrounding confidentiality, discretion, and ethics are adhered to as we go forward. But yes, it's an extremely important area as we develop and as we look to open up. Contact tracing for us is indeed important.
Linda Straker, questions from you?
Good afternoon, all. I have a number of questions, so I hope I can get through as much as possible. But I'm starting with the issue of marine traffic. We open up easement internally, parish to parish. It can happen every day. Every day is a business day. However, in the case of Karakou, we've seen the Osprey is only allowed to operate for 3 days, while the Dollar Sea is operating once. Can you explain the reason, the decision behind that? I don't know if it's Dr. Mitchell or the minister would explain that. And then we have the issue of, last week we saw one of the yachts coming in and was welcome, and I think they have to go into quarantine. Are boats allowed to traverse between the islands, Grenada or Karakou, because it is one border? My other question for now has to do with masks. Is there a difference with help person explain the difference between if a mask and a face covering has to be used? Is it mandatory for a mask or a face covering? Thank you for now.
Okay, Linda, let me try and address those issues quickly. One, according to regulation, is face covering. We do recognize, I'll be the first to say, there are masks, and there are face covering and face covering. I've seen certain people that, according to regulation, would be compliant, but I can safely say that those masks that they're wearing, which is like a knitted mask with almost a centimeter size holes, are not going to be protecting them. And people should think twice about that. We've already discussed, and over the next couple of days we'll be coming out with some public information with respect to the appropriateness of masks, because that too is a balance. Too thick a mask and individuals have difficulty breathing, especially when you are carrying out physical activity. And too thin a mask, then it possibly doesn't screen as much and protect you. So we will be giving some advice as to that middle ground. And that middle ground will vary based on the individual's, the type of activity, the type of mask maybe that would be appropriate for a construction worker. It would definitely be different to the type of mask that would be appropriate for a medical worker, or a customs officer or immigration officer on the front line. And also we have to look at our students, individuals on public transportation as opposed to individuals who are carrying out public transportation. There may be additional need for on a hair, like for instance we have an example of a face screen, which is also another tool that can be implemented. And this is usually used by dentists and will be used by our medical team that are involved in hands-on medical attention. So they have a plethora of variations, and I think now, and we will be doing it in terms of giving information as to what to follow. In terms of inter-island travel, we cleared inter-island travel. We requested that it be at a certain level of restriction, and we left it to the providers as well as the mainly the people of Karakou to sort out a schedule or so. As to whether that schedule is ideal, maybe not for some individuals. I'm sure for any of us who may want to be going back and forth to Karakou, would like to have as many choices as possible. And I'm sure for those who provide the service, they would want to be doing it as often as possible. What I would ask is that quite possibly just give us this week. Let's make sure that the system works. And very quickly, I'm sure by next week possibly, that we can look at an increased schedule, because we would recognize that the record keeping, because we've put certain restrictions on them as well, or certain responsibilities. They are to keep record of everybody that boards their vessel. So that if someone shows up in Karakou, or someone from Karakou shows up in Grenada with a positive test or so, or interacted, we would know exactly who was with them on the vessel. So those kind of things we want to make sure in place and are being done properly before we say any and all days of the week. So quite quickly, I think once the providers of the service are doing the proper following of the regulations, we can look at further regularization of that service in terms of frequency. And in terms of private vessels being able to go, the Commissioner had addressed it. So just for clarity, what we're saying is it's not restricted. We're just asking, in the same reason, to keep records. It's not that we want to prevent people from traveling between Grenada and Karakou, but we want to be able to keep records that we know what's happening from a contact tracing point of view. So if you have a private vessel and you wanted to go from Grenada to Karakou or Karakou to Grenada, we're just asking that you simply notify the authorities to let us know that you are actually changing locations and will be moving one way or the other, northbound or southbound or so. That's just for record keeping.
Thank you very much, Minister. Rena Pear, you're next. Mikey, I see your hand, but we have Sharia next in queue, and then we'll come back to you. Go ahead, Rena.
Okay, good afternoon to everybody. My first question is to Dr. Mitchell. Is Grenada considering doing convalescent plasma therapy as it relates to treating COVID-19 patients? I know it's approved by WHO. Also, Minister Steele, my question to you is, could you enlighten us, or do you have any idea what is the protocol for persons coming into Karakou from Union Island as we lend hand to them as it relates to the fuel? I'm talking about protocol as it relates to, is it one particular agency that's going to be coming for fuel, or anybody's just going to be coming? Also, a question again to you, Minister Steele. Could you confirm the farm workers that are scheduled to go to Canada, could you confirm that they would be leaving, or there would be a chartered flight coming for them soon? And to Commissioner, my question to you is, could you give us an update as it relates to the recent suicide in St. Patrick's and accusations made that members of the Royal Grenada Police Force did not take the cry for help from the individual and from other persons who were close to the individual to the Royal Grenada Police Force in dealing with the issue?
So, Arena, let me take your question first. I think I have the shorter end of the stick here. In terms of your question whether or not we are considering using plasma convalescence therapy or convalescence plasma therapy, just to say that, and we have said it before, that we continue to exercise all options going forward in terms of treatment of COVID-19. As the science continues to evolve and treatment applications and modalities continue to evolve, our scientists, our doctors at the hospital are continuously monitoring those applications, those regimes, and we're going to spare no effort to put our hands on the best treatment options that are available all over the world. And I hasten to say the word available because sometimes these treatment options are extremely difficult to get our hands on. But yes, we are going to consider all options in treating our patients.
Thank you. Union Island fuel. There is a protocol that's in place similar to the vessels that were coming from St. Vincent waters to offload cargo, etc., as well as yachts that were in quarantine that needed to come and get fuel ashore in the Carriacou area. In short, it is monitored under a controlled environment by police in Carriacou and the provider of the service. That technically the best way to describe it is the individual does not come ashore. The individual stays on their boat and will receive their fuel dockside, and then will proceed to go back to Union Island. At present, the mechanism for entering Grenadian waters is that you must seek permission. So we expect those who need fuel, our brothers and sisters in Union Island would simply contact our Carriacou divisions and get the relevant permission and the relevant time so that it can be monitored and that the fuel can be provided to them. With respect to the farm workers, no, I do not have any details on that. That has a lot of moving parts because that would also be at the discretion of the Canadian government as well. I know that the Ministry of Labour, so I will confirm with the Minister of Labour, who is also the Minister of Foreign Affairs, to find out if there's any update. And if I do have an update, I will let you know during the proceedings here or to the team, GIS team, so they can let you know as soon as possible.
Thank you very much, Rena, for the question. And this matter is one of the issues that made me raise very early to indicate that the police will have a press conference tomorrow to address a plethora of law enforcement issues. But the fact that you raised this matter, I will give a preliminary response to it. And let me first say that this has been a very sad, unfortunate, and depressing situation. And I want to take the opportunity here to express sympathies and condolences to all parties concerned in this matter. Here, though, I can acknowledge, because I have already initiated an investigation into this matter, and let me also thank the media outfit that reached out to me personally and provide me some information and make inquiries on this matter. I think if we continue to work harmoniously in this manner, as this particular media outfit did, we will go a long way as a country. But I can say to you now that yes, the dispatch center of the RGPF received 2 phone calls as it relates to this matter. The first call was dispatched to the police station to initiate a response. The investigation will unearth how that matter was investigated, and hopefully I might be able to have a summation of that by our press conference tomorrow. The second call from the same caller came in, and the dispatcher took the information, which we still have, as to how to contact the person of concern, and made a number of efforts to contact the person, which was futile. And of course, we all know, very sadly so, what the eventual outcome was on this matter. Certainly, this is a learning experience for everyone in this situation. And it bears testimony to how we need to respond as a nation to all persons, not just of this nature in crisis in a general sense. This matter has my personal attention, and I definitely will follow it through to the end to have clarity as to whether or not the RGPF had an opportunity to prevent something negative from happening one way or the other, and whether or not we treated with the information we received in the correct manner. So thank you very much, and condolence and sympathies again to all parties concerned.
Sherry Anwell. Sherry Ann, would you unmute your microphone, please? You're still on mute, Sherry. Okay, so what I'll do, I'll go to Raul Patterson, who is holding, and we'll come back to you. Raul, are you there?
Yes, I'm good.
Go ahead, Sherry. Go ahead. Raul, we'll come to you next. Go ahead, Sherry Ann. Sherry Ann, can you resolve your audio issue? If not, we're going to go to Raul and then come back to you.
Hello?
Yes, we're hearing you now. Go ahead.
Hello?
We're hearing you now. Go ahead.
Yes, my question is in general. What I am trying to get, as it relates to the protocols for the reopening of the barber shops, hair salons, nail techs, and so, if there will be further easement based on the fact that these professions entails closer contact between the person offering the service and the person that's going for the service as it relates to the 6 feet social distancing and so. So will there be any amendment to the protocol as it relates to these businesses now that they have been given the permission to be reopened?
But let me say that all of those businesses that you mentioned, so barbershops and salons, hairdressers, beautification industry, falls under the Allied Health Safety Act. They are to be licensed and to perform any of those services to the public. And in getting that license, they are to comply with the various safety measures, the safety measures that existed before COVID, with respect to keeping their clients safe. Those would have been with respect to hepatitis and other types of diseases that could have been transmitted or could be transmitted, any type of communicable disease in general. But now with COVID, there's an extra level of protection that they must put in, but still fall under the Allied Health Act, and we intend to have that Act enforce their operations. In fact, no one is supposed to open without notifying the Allied Health Secretariat that they have intentions of opening, and then would receive that response or permission to go ahead. And that is not using our COVID laws, but using our Allied Health Safety Act laws, that they must be compliant there.
Can I add, Minister, that yes, I understand that there has been some sensitivity, and there will be some sensitivity in relation to that particular industry because of the close contact that is natural in that industry, and that is why we took pains in ensuring that this industry was not open 2-3 weeks ago, because we had to make sure that the standards, the protocols were well developed and that they were understood. Now that we have developed them and we have publicized them, I think the important thing to note is that yes, there would be a monitoring system to ensure that those are monitored in a systematic way, and that yes, we are, through the registration process, developing a database so that that can be appropriately and adequately done. So I understand the nervousness, but it was not done just, okay, we got up yesterday morning and say, beautification, you can open now. It was done after lengthy thought and putting the protocols together. And inherent in those protocols are the main elements, and we are going to ensure that those are strictly adhered to. The issue of mask wearing or use of face covering, appropriate face covering, the issue of social distancing are going to be extremely important as that industry opens up, and the issue of ensuring that we have no accumulation or gathering in these locations is extremely important as well. So all of these places are expected to adhere. If not, regretfully, measures would have to be taken to close these industries down, because those are, as we said, areas where the proximity and the close connection are unavoidable because of the kind of service that they provide.
One question of clarity here for either the Minister or Dr. Mitchell. In relation to this particular industry, when we spoke about the inter-island transportation, manifests are required now for contact tracing purposes. Are we similarly going to require that from persons in the industry in the event that something were to show up later?
The list of the individuals that they served, and in fact most of the providers are saying that they would prefer to operate on a reservation system or appointment system. But where that is not possible, they need to have that list of individuals that were there together, and the waiting area needs to be spaced out completely.
Can I add that this is going to be industry standard? All of the places that we're going to be moving to open in a systematic way will have to, and I speak to, for example, call centers that we're contemplating to open, and that kind of business that we need to know everyone who's been there to be able to do appropriate contact tracing. So I think the construction industry has done that extremely well, and I really, really admired how the protocols were followed. And so on any construction site, for example, anyone entering that construction site, be it a worker or a visitor, they would have to be registered going forward. So that is extremely important going forward.
I think just to add and touch on a point that Commissioner had raised earlier, we saw it in the construction industry, and by and large, based on the communications we've had to date prior to the opening of the beautification industry, the desire of individuals to be compliant and a recognition in their sector also, by and large, the majority want to go that distance to make sure that not just that they can open as safe as possible to the public, but that they can stay open to the public as long as possible. So we found in general, and we look forward to that industry or that sector assisting in regulating itself to and maintaining that standard that we're asking them to keep.
Roll Patterson, are you still with us? Roll, please unmute and you can go ahead with your questions.
Can you hear me now?
Yes, I can hear you. Go ahead.
All right, good afternoon to everyone. What are the factors that influence for the reopening of the ferry service? And secondly, what are the high level of surveillance that we have in place to ensure that, of course, the proper protocols are maintained when people are traveling on the ferry? The reason for this question is simply because those of us who have traveled on the ferry would greatly appreciate the fact that when the water is calm, you can maintain, of course, social distancing. But if the water is rough, it's difficult to maintain social distancing, as I guess we have, of course, on the ferry. My next question is to Commissioner Martin, the issue of a set application process for those wishing to travel. Could you just walk us through exactly what the process is like? And my other question is that the last time we spoke, Dr. Martin said there were 57 persons across Carriacou and Pitmatic who have been tested. Could you give us an update as to where we stand in the figure right about now? And finally, have the Ministry of Health considered the issue of e-testing for people who are COVID-19 positive?
Okay, Paul, if I can address the first part of your question, which was the monitoring of the ferry service. I think we had mentioned that they are to keep a log, and yes, I do agree with you. There's a difference between rough water transit and calm water transit. That is one of the reasons why we're looking at this limited or this phased approach to make sure that we have catered for all of these possible eventualities. It's not with the expectation that this week we'll be able to witness a rough passage and a calm passage, but that this week we will be able to witness with the limited service the various control mechanisms working, and to be able to be as sure as possible that as we proceed with increasing the frequency, that we are able to maintain the monitoring and the record keeping, in the hope that none of the passages are too rough, but that in the event that there is one, that our proper mechanisms are in place. You had asked about e-testing. I'm not sure what you are referring to with respect to e-testing. I know that some other countries have the ability that on the internet you can apply for a test and it is sent to you, and you do the test at home and send the actual sample back to a lab. If that is what you are referring to, no, we are not going to be doing that, because we rely on PCR testing, and which is also necessitates having complete control of the logistics from individual all the way to the lab. That is a safety measure that we insist on. And in terms of the number of tests done to date, this is going on regularly. So we can give you an update, probably send an update with respect specifically to Carriacou and Petit Martinique, but Dr. Mitchell would have a national figure. But we don't have it at it is there, but we don't have it when we come here in terms of Paris to Paris, or the difference between Grenada, mainland, and Carriacou and Petit Martinique. But that can be gotten for you.
Yes, Minister, I was not sure what Royal Patterson was referring to on e-testing and the issue of the 57. That was specific to Carriacou, I reckon. As you correctly said, we don't have the Carriacou figure like as of today, but we have some national figures. And I'm proud to say that we have topped the 537 PCR tests. We continue to test almost every day, and we have topped the 3,000 rapid tests. So we continue to motor on as we continue to screen, because this for us is extremely important. Without continuous screening, without a systematic screening method, that we cannot say for sure that we don't have the virus circulating there. So that is one of our strategies going forward, ensuring that we do systematic, targeted testing among most at-risk groups as we continue to evolve our strategies in opening up the country.
And Raul, just for me to address the last part of your question as it relates to the application for inter-island travel. For the avoidance of doubt and the abundance of clarity, let me first indicate that the Osprey and Dolly C has been approved for travel, limited travel within the islands. So it means that anyone wanting to travel by those means, first and foremost, will be able to do so. The issue of additional clearance has to do with other vessels wishing to traverse between the islands. And as indicated by Minister, what is simply required is a notification into the Port Authority, who according to our regulation is the authority, so that as Minister indicated, we have an idea, just in case we have to do any contact tracing for persons who move between, we have an idea of what is happening at this stage of our easement. That is likely to improve going forward, but is what is extended at this point in time. I hope that adds clarity, and I thank you for asking, so I can again double down on the information for greater clarity. Thank you.
Mikey, you had another question for the panel?
Yes, I have two follow-up questions. Now, since it was announced that government will be opening the borders soon, persons have been in search of more information so that they can make informed decision on their travel plans, as well as the public would at least like to know some more information in terms of the different courses of actions that will be taken. Now, there's a press release that stated that the government is looking to reopen in June. Now, are there any specific dates that the government is now targeting? And relating to the protocols, can you offer some more specificity in terms of the protocols? If someone is positive, what happens? If somebody's negative, if somebody is suspected, what happens?
Mikey, with respect to a date for opening, we've approached it a bit differently, and in fact, that went to Cabinet today and got the approval. There are certain milestones that must be passed or accomplished. The number of rapid tests on island, in stock on island physically, before we open, a requisite number, literally a 3-month supply. The mechanism to test at even higher levels, although we have increased our ability to rapid test. We have to even further increase that and see it working and know that it functions before we allow flights to come in on a regular basis. The ability to have even more sensitive and greater levels of individuals involved in contact tracing, to react much faster, and to react much wider before we allow regular flights in. The ability to maintain quarantine facilities, although we're doing that now, but a stronger control mechanism on it before we contemplate the flights coming in, as well as ensuring that while we have strengthened our health system to react to the possible eventuality of somebody needing medical attention as a result of COVID-19, we're going to take this time as well to further strengthen it and put additional mechanisms in place before we allow the first flight in. So I know it is creating a lot of heartache and confusion to those out there who simply want to book a flight and come home. And I look forward to the date that we can announce that, and then that date that we can welcome them home. But as is in the case of the individuals who returned from cruise ships, it shows that our reason to be additionally cautious has been valid there. And I truly believe that our reason to be cautious with respect to opening up our borders and actually committing to an early date is valid as well, our delay so far. So I'm asking those out there to bear with us. It is to ensure that when, not if, when you return to Grenada, that the Grenada you return to remains the safe Grenada even after we open up to allow you to return. I think the last thing that any individual, those of us here and those of us dying to come back home, wanting to come back home and deserving to come back home, would want to know is that in this action to allow that we jeopardized and created an even bigger problem of exposing the entire nation unduly to COVID-19. So please bear with us. We will make the announcement once all of the various measures and steps are in place and the milestones have been achieved. It is safe to say that reasonably we must give a 2 weeks notice. Reasonably we must give a 2 weeks notice on a possible date. And that is the most I can give right now, not having any of those other milestones in place to give any further information. But you can deduce from that there's a 2 weeks notice that should be given and must be given for the airlines to schedule their flights.
Mikey, your microphone is muted. Mikey, your mic is muted.
Okay, not from my end, but all right. And my other follow-up question relates to case number 15. Now, I know that several press conferences ago, you said that you were doing some contact tracing to ascertain whether or not there was community spread. Where are we with that investigation?
The contact tracing on case 15 and all of our cases are, I can say, closed if there's such a thing. We have no further evidence of anyone else being infected. Those that are at or were at possible risk, and there are individuals that still are, that we have quarantined in their homes under observation. And as such, there is not right now, based on the scientific definitions and the way it is scientifically ascertained, there is no evidence of community spread in Grenada.
Thank you, Minister. Linda, you had a follow-up question. To those who are posing questions now, can we stick to one question? We've gone over the hour, and we know that some people have to get ready for news time. So let's keep the follow-up questions to one, please.
My follow-up question has to do with transportation, which is public transportation. In the regulation, there is a limitation or a ban on public transportation of buses, as well as public transportation of vehicles for hire. In resuming and discussion taking place, is it public transportation for buses, or is it public transportation of vehicles for hire? I need that to be cleared up. And would the minister tell us the name of the ship that came in that had the person who is now positive? And for Dr. Mitchell, the Allied Health Practitioners Act, does it make provisions for professionals to be registered, or in addition to the places to be licensed? Explain that for me, please, because I was of the opinion that the Allied Health is to register these persons and not necessarily the business place. Thank you.
Yeah, thank you very much, Linda. I'll take the part on the public transportation. The idea is to open up the operation of buses, and that's what we are pursuing. And of course, by extension, for taxis as well to operate. The reason why it's not in the regs as yet is simply because the matter is still under consideration. We are still working out those details. We are working with all stakeholders concerned in this matter to come to a position where we can implement a very seamless operation when this is ready. If it happens to be finalized this week, it will be announced at the appropriate time. But all efforts are being made for this to be operationalized as soon as is practicable.
Just to add to that, government is not a provider of public transportation in Grenada. Government is a regulator. There are certain facilities that government provides for the use of the individuals who ply the trade. Those facilities have to be adjusted to make sure that there isn't unnecessary risk, that is crowding of individuals while they are waiting to get on or get off the vehicles. And also, as Commissioner implied, that the stakeholders, the providers of the service, have got to be given an opportunity in the same way that we did with the construction industry, an opportunity to discuss and comply or find out the mechanisms that will allow them to comply with the health regulations that we are looking at putting forward. In terms of the ship, well, I mean, it's clear that it was a vessel that came in yesterday. It didn't come in under the darkness of night or so, and any other veil or so. The vessel that came in was a vessel that belonged to Royal Caribbean Cruise Line, and that all of the individuals who came ashore yesterday are employees of Royal Caribbean Cruise Line. But I caution that type of questioning, Linda, in that on the same main issue of the stigma. It matters not which, and it matters not which industry or so. It is that there are Grenadians out there who were stranded, and these individuals did nothing wrong. These individuals were working, simply working to make a dollar, as we say, to provide for themselves and their families, and actually went the further distance to be away to do this. And in the carrying out of those duties, they were exposed to COVID-19. Those who came in and did their quarantine, as far as we as a government were concerned, there was a risk of them being exposed. And those who came in yesterday and the one who tested positive was exposed through no fault of his or her own. And we have to recognize that as a people. The too many details suggest that we want to know exactly who so we can differentiate, as opposed to simply that our mechanisms were put in place to screen and test any individual coming back, any Grenadian being repatriated. We have had others come back who are not cruise ship as well, who go through the same level of screening, and anyone else coming forward go through the same level of screening and quarantine where the risk necessitates that. So I just want to say that my heart goes out to them, and I think it's necessary to say that the individuals who are still on cruise ships, Grenadians who are still on cruise ships waiting to come back home, and that we are working as hard as humanly possible and beyond to find the mechanisms that will allow them to come back home, and any of the others out there who are also waiting on flights or some other mechanism. We haven't been with the attitude of kicking the can down the road and just delaying it, is to find that mechanism, that safe and practical mechanism, as soon as possible. The allied health and thing.
Yes, the Allied Health Practitioners Act speaks to the issue of registration and licensing of those persons plying their trade in that particular industry, in the beautification industry, as we call it nowadays. And in this period, we did not want to stifle that industry by asking people to get registered and licensed at the same time. So we said, go ahead and register, just like we did with the construction industry, so that persons can get their businesses up and running. But eventually, they will have to get licensed. And license speaks to the qualification and certification of that particular business and the personnel who ply their trade within that industry. But for now, the issue is making sure that we get an appropriate database of persons registering with the Allied Health Practitioners Council, and so that an appropriate mechanism can be set up so that those persons can be visited posteriorly and be licensed in the near future. Obviously, as I said before, it is critically important now that that we set up systems to monitor those and to ensure that they comply with all that we've been saying because of the nature of this particular industry in terms of close contact. So we're actually making a really, really big appeal out there to those in that industry to please ensure that they stick to the protocols and the regulations that we have put out there to govern safe practice in that particular industry.
Thank you, Dr. Mitchell. Nancy McGuire, you had a follow-up?
Yes, I was wondering if I could get an answer to the number of contact tracers we have and who is going to be training them, especially now the minister noted that we're going to be doing more faster and wider contact tracing once we open our borders. And a question on the systematic target testing. Will that include people that are experiencing homelessness, and who is this target testing? Thank you.
Well, on the issue of the number of contact tracers, I'm trying to get as many as possible, and there are 3 different levels that we're looking at. Those would be level 1 are those that are full-time involved in the Ministry of Health, either in the districts or like, for instance, our chief epidemiologists, our district medical officers, or district nurses, etc., that are out there. That's level 1 of the contact tracing. Then there is the resources of the Royal Grenada Police Force. There are also retired individuals who have those qualifications but won't be frontline, but we'll be doing contact tracing. And then there are also individuals that we're looking to set up a brigade, so to speak, of volunteers that would be available should the need arise for contact tracing. And that is the model that we have been taking from Pan American Health Organization, as well as other countries that have been successful with it to implement here in Grenada. So it's not simply how many are full-time employed numbers. And the easy answer on that would be the total amount that are involved in the district and in the public health department of the Ministry of Health. But we're going beyond that in this instance as we move forward. With respect to training, the training would be from Ministry of Health, from St. George's University, and from Pan American Health Organization for that, various different courses, etc. One of the key parts of that is confidentiality and medical ethics in dealing with the case. I'm not sure if there was another question there. Yes?
She spoke to the issue of targeted screening.
Right, targeted screening for homeless. Nancy, screening is done based on risk analysis. Screening is done based on symptoms or interactions or so. Screening isn't necessarily done based on place of abode or lack of a place of abode or so. It's how often, or what the chances are of somebody at getting COVID-19, and that is being close or interacting with someone. And that's the mechanism. As to whether anyone who might be homeless currently fits that description, if they do, they will be tested. If they don't, then they will possibly be in a secondary level, or random testing would be the only way that they would be tested. But we're trying to be as direct as possible, and also at the same time there's a certain level of random testing that is being done, and it goes by day to day. For instance, yesterday there would not have been a high level of random testing because the team would have been very much involved in testing all of the repatriated cruise ship workers that came in, so we would not have insisted on further testing there. But today would be an example that they would have been out there testing individuals who may have presented at any of our health facilities or private health facilities, and also out in the communities in general with a certain level of random testing.
Royal Patterson, your follow-up, please. Okay, Royal seems to have left us. Rena, you had a question as well?
Yes, my final question is regarding public transport. Just to say that there are persons out there who will be having an easement of restrictions. We do have persons who are self-employed. They would like to give their service but don't have public transport or have their personal transport. Is there any consideration for hired vehicles, maybe taxis?
At the moment, the regulations do not permit, as the Commissioner had said earlier. Discussions are being had with the providers of public transportation to get that up and running as quickly as possible. The soonest, quite likely, could possibly happen as soon as Wednesday, but it's dependent on all the stakeholders coming together with a viable model, while adhering to the restrictions that the Ministry of Health have put, or the COVID committee have put, to ensure safety as best as possible. I know that other firms have arranged private hire arrangements with providers of transportation, so that is possible to be done. But in terms of having individuals just applying a route and looking for someone to raise their hand and hire them or so, no, that is not allowed at present. I look forward to that happening as soon as possible. That is dependent on all of the stakeholders coming to an agreement that also, most importantly, allows us in the Ministry of Health and the RGPF to monitor and regulate.
Thank you very much, Minister. So I don't see members of the media having any more questions. I don't see any hands raised or any comments in the chat. So I'll take it that we've exhausted the questions for today. And gentlemen, I'll ask that we have some closing comments. Dr. Mitchell, we'll start with you. I see you're ready.
Yes, thank you, Philo. I just want to say thank you to everyone who has been part of this response, all our categories of workers who've been out there, all the persons who have supported us, persons who have given us their comments, their criticisms, and pointed us in the direction of going the right way, so to speak. I really want to thank them for their support. I also want to reiterate the fact that as we ease up, we must, and I want to reiterate, we must continue to stay vigilant. I have noticed that because we seem to have entered in this phase and persons feel more and more comfortable that some persons do not wear their mask, especially when they're out. I want to make a special appeal to folks that if we ought to remain open, then we need to do the right things. We need to wear our masks so that just in case we do have a case out there, then it's not able to spread from person to person. So that is the message. And in closing, I want to say that of course, we continue our mantra of people and health first, foremost, that we don't want a situation where we lose anybody for COVID, and that once we open and open in the proper way, taking our time and doing the right things, we don't want a situation where we have to close back. So we want to open right, we want to open, take our time to open, because we don't want to have to reach in a situation where we have to close down. But to be able to do that, everyone needs to do their part. Thank you.
Yeah, thank you. And I just want to add my last bit as well to say a massive thank you to the population at large. I believe as a collective, as a nation, we have done exceedingly well in stemming the tide. And can we do better? I think so. But I think to do that, we must continue to be role models to our colleagues in society and not depend only on the frontline workers, Ministry of Health and police officers. We all have a fundamental role in this fight. And I believe as a nation, as Grenada normally do and rise up whenever we face a challenge, whenever we face adversity, as a resilient people, we tend to conquer this. And so I want to appeal to our people to let us achieve this cultural transformation that we need, because COVID is here to stay. So finally, I want to extend my appreciation to the RGPF, the entire rank and file for its support, the frontliners in the medical fraternity, and I need to say a special thank you to Her Majesty Prison and the officers there who have been doing an awesome job in ensuring that nothing come into the prison that can cause an infection there that can lead to even a more catastrophic consideration. So while they are in the background, they have been serving as well. So I spend time today, as I've never done before, in giving special recognition to our colleague officers at Her Majesty's Prison. Grenada, thank you for the support, and I look forward to your continued support as we try to deal with the issues facing us as a nation, as we always do. Thank you.
In closing, I want to address the issue of stigma, and to say that if we stigmatize individuals who appear to have symptoms, or maybe have a job that is high risk, or may have just returned after doing their quarantine, etc. What we are going to do is to create an environment where people are afraid to come forward and say that they feel sick. People are afraid to come forward and report, and we're actually going to make it worse for ourselves. The individuals who have done their quarantine and have been passed have done their quarantine and are passed and are safe to circulate among us and should not be treated any differently. They've done their time. They've followed their protocols. They have done their time. If there's any such group of individuals that should be stigmatized, are those that are not following the protocols, those that are not wearing the masks, those that are not adhering to the social distancing. Those are the individuals that we should be stigmatizing out there. But the people who are compliant, the innocent, who are compliant, should not be stigmatized. And the group I want to recognize today are the cruise ship nationals, recently returned, and those still out there waiting to return. It's not been a vacation for them. We do understand that. It's been psychologically, physically stressful. And we look forward to them coming home, going through the protocols, and getting the clearance as quickly as possible. And all of our Grenadians out there, mothers who have been separated from children, brothers separated from sisters or family siblings, Grenadian nationals who live here and were caught out when we closed those borders and are waiting to come and do their time too, their quarantine, their testing, to be back in circulation with us. And my heart really goes out to you, and I want to thank you for your patience. Many of you have been reaching out to us and been supportive of what we're doing, but also saying, that you can't wait to come home. Please let us know when you can come home. But in general, supporting, because you do recognize as well that you have a safe home to come home to. So my heart goes out to all of them, and to keep the faith, keep the support. We will get you home as soon as it's practical, as soon as it's safe. And to the rest of us that are here, those who newly have entered Grenada and are now in circulation among us, and those of us who have been here all the time, practice the social distancing. Wear the mask when out in public, and adhere to the protocols so that we can all stay safe. Thank you all.
Thank you very much, Minister of Health, Honorable Nicholas Steele, Acting Commissioner of Police, Mr. Edwin Martin, Grenada's COVID-19 Response Coordinator, Dr. George Mitchell, and a special thank you to Ms. Kathy Dubisset for the provision of sign language services this afternoon for that section of our audience. Thank you to media colleagues for joining us for this press briefing, and to those who have tuned in, I trust that you got a wealth of information. Remember, the RGPF will host a press conference tomorrow. We'll advise you of the time of that through the usual GIS notification. I am Press Secretary Philomena Robertson. Thank you so much for tuning in. We'll see you again next time.
I say, nah, man. Wood. Yo, this is the Dan man Lindy telling you to be COVID-19 safe. Stay home. That way we could play a mass sooner rather than later. Everything will come to pass. You know the tingo. Mass must play. How you mean?
Boom shakalaka, this is Ledneck from the West Point family, reminding all Grenadians to be COVID-19 smart. Stay home, it's just for a short time. We will be back on our feet soon. Alright? Bless.
Stay up to date with all that's happening with the new National Party, NNP. Send us a message via text or WhatsApp on 405-8683 with your name, email, and constituency. Stay in the know with NNP. Get updated.